Hi, welcome to the Nurses Academy. Today we will discuss about acid-base imbalances, which is very important topic to our nursing competitive exams. Let us discuss. Acid-base balance must be maintained by the body if any change cause acidosis or alkalosis. So our body must maintain acid-base balance. Okay, normal pH is 7.4, slightly alkaline nature. Our blood pH is normally 7.4, that is alkaline nature. The range between our blood pH range between 7.35 to 7.45. Some of terminology we will discuss. Okay, pH means power of hydrogen. H plus means hydrogen ion. CO2 means acidic. This is also in our blood. It is having partial arterial carbon dioxide level. That is also acidic in nature. And H2 CO2 H2CO2. How it will form? CO2 plus H2O. This is also acidic in nature. It is called carbonic acid, which is called carbonic acid. And HCO3, this is alkaline in nature. Next, HCO3 means so bicarbonates. Next we will see regulatory system of how our body will maintain acid-base balance in our body. Okay, there are 4 types of acid-base balances will happen in our body. First one is chemical buffer. Second one is lungs. Through lungs also acid-base balance will be maintained. And third one is kidney. Fourth one is potassium exchange system. Let us discuss one by one. And this is, if our blood is 7.4, it will maintain blood pH is 7.4. If it is decreased below 7.4, it is called acidic nature, up to 7.35. If it is more, if it became 7.45, that is called alkalotic nature. Next, we will discuss chemical buffer. Chemical buffer system. So, how chemicals will maintain our blood pH? First one is carbonic acid, and second one is hemoglobin system. Third one is plasma protein. Fourth one is phosphate system. The first one we will discuss carbonic acid and bicarbonates, how they will maintain the blood pH. Carbonic acid and bicarbonates, CABs we will call, and H2CO3 is called carbonic acid and HCO3 is called bicarbonates. In our blood, the percentage will be 1:20. And carbonic acid, it will be there in carbonic acid mainly will form by the lungs and first degree buffer system in our body. If they will ask question, first degree buffer system in our body is carbonic acid. Bicarbonates are HCO3 called HCO3 and it will be formed in central in kidney. Next we will discuss hemoglobin system or chloride shift also will called. How hemoglobin, how it will maintain the acidosis and alkalosis. In acidosis what will happen? There is a increasing of the pH and CO2 decrease pH and increase CO2. Okay, here we can see in acidosis what will happen in hemoglobin system. In our blood what will happen? There is a CO2 increases and pH decreases. Okay, then what will happen? CO2 with Cl chloride, it will enter into the cell. Then what will happen? Chemical reaction will happen. Then Cl, then what will happen? CO2 will enter into the, with the Cl with chemical reaction happen. Then CO2 with H plus ions, it will form H plus ion plus CO2 will form bicarbonate. Then the bicarbonate from here, bicarbonate will form. It will come outside of the, outside means in the blood. HCO3 will form, it enter into the blood. So there is a balance, pH balance will be happen. Then alkalosis. Alkalosis what happened? CO2 decreases and pH increases. Here what will happen? From the blood, HCO3 will enter into the cell. Then CO2 will come outside. HCO3 will enter into the cell. H plus ion remain in the blood and CO2 will be come outside. Then blood pH will be maintained. Next we will discuss. This is hemoglobin system otherwise called chloride shift. Next we will discuss how lungs will maintain the acidosis and alkalosis. Acidosis, increase CO2 level. So here lungs increase CO2 level and then pH also decreased. So here what will happen? Think this is human body. Increase rate of and depth of the respiration, and O2 will enter into the lungs. This is our lungs. Then carbon dioxide will come outside from the lungs. So through this way, the lungs will maintain the acidosis. Next, alkalosis. In alkalosis, what will happen? CO2 level will be decreased and pH will be increased. Then hypoventilation. Hypo means decrease depth and rate of the respiration. Then CO2 remain in lungs. Then pH will be maintained. Next, we will discuss kidneys, how it will maintain. In kidneys, main role is forming of bicarbonates. There is H plus ions. If there is increased acidosis means pH will decrease, and here what will happen? H plus ions will increase. Then what will happen? The kidney will absorb the H plus ions. Then maintaining of the acidosis. Alkalosis. There is a H plus ions will decrease. Then kidney will do reabsorption of the H plus ions. Then we will move on to the next, phosphate, potassium exchange system. Here also pH decreases, then H plus ions increases. What will happen? H plus ions will enter into the cells and K plus ion come out from the cells. Then what will happen? Hyperkalemia will happen. Alkalosis, pH increases, H plus ions decreases, then from the cell, so from blood, K plus ion will enter into the blood and H plus ion come out from the cells. So here we can see from blood K plus ion, because H plus ions are very less in the blood, so that K plus ion will enter into the cell and H plus ion will come out to the blood. There is a maintenance of the pH. Next we will discuss acid-base imbalances. So we can classify acid-base imbalances are two types, respiratory and metabolic. In respiratory, there are two kinds, respiratory acidosis, respiratory alkalosis. In metabolic also, two types, metabolic acidosis, metabolic alkalosis. Okay, in respiratory acidosis, what will happen? Simplifying, acidosis always decreased pH, and respiratory means CO2 will increase, means then we will call respiratory acidosis. In alkalosis what will happen? See, always alkalosis means pH will increase more than 4.5 is called alkalosis, and respiratory alkalosis means here CO2 level decrease in our blood. Then what is metabolic acidosis? Here pH decrease, always pH decrease, and HCO3 also decrease. And alkalosis, pH increases and HCO3 increases. We have to think about acidosis means carbon dioxide will increase and form carbonic acid. Decreases means carbon dioxide level decreases, then pH will be decrease. Forming of bicarbonic acid only, acidosis will be form. Next we will discuss about the respiratory acidosis and base imbalances. Acid-base imbalances we will discuss. Already I have discussed about the respiratory acidosis. Here pH will decrease, CO2 will increase. Which cases we can see respiratory acidosis means? All lung related diseases, COPD, asthma, pneumonia, pulmonary edema, brain trauma, sleep apnea. How this acidosis will maintained? Here mechanism, the kidney will maintain this problem. If respiratory acidosis will occur, metabolic kidney will maintain this acidosis nature. So there is a increasing, CO2 will increase, and then H plus ions also increase. Here what will kidney will do? H plus ion excretion means here carbonic acid will form. Then the kidney will excrete H plus ion and CO2 will remain. Through this way, the kidney will form the sodium bicarbonates in our blood. It is alkaline nature. There is a maintenance of pH. Next we will discuss what is nursing management in respiratory acidosis. We need to give plenty of fluids, IV fluids also, fowler's position to the patient, administer O2 to reduce if PaO2 is more than 50 mmHg. Normal is 35 to 45 is normal range PaCO2, and we have to monitor for potassium levels. In respiratory acidosis, there is chance of getting hyperkalemia. Already I told H plus ion will enter into the cell, K plus will come out from the cell, then forming of hyperkalemia. We have to see here hyperkalemia. As a nurse, we have to closely monitor. Next we will discuss respiratory alkalosis. Alkalosis means pH will increase more than 7.45 and CO2 decreases. So when this condition will happen means exercises, hypoxia, fever, pregnancy. These are all primary causes, and secondary causes are anxiety, stress, smoking, septicemia. Secondary causes, this also cause the respiratory alkalosis. How kidney will maintain this one? Here CO2 decreased, then kidney reabsorbs the H plus ion, and with this sodium bicarbonates, then form sodium bicarbonates, then increasing of CO2 in our blood, reabsorption by the kidney, and CO2 remain in blood. See here what will happen, kidney reabsorbing of the H plus ion and CO2 only remain in blood. There is increasing of CO2, then maintenance of the respiratory alkalosis. Next we will discuss about the metabolic acidosis. Here pH decreases, HCO3 also, bicarbonates also decreased. If it will be happen like this, cell will be breakdown. Which cases we can see metabolic acidosis? CKD, CLD, chronic liver diseases, cancer, GI wound drainage, diarrhea, and diabetic ketoacidosis, DKA. Management of mechanism means how it will manage. Here if metabolic acidosis will occur, the lungs will be maintain this problem. How? Lungs will be excrete the CO2 and through hyperventilation. What is hyperventilation? Taking of deep in depth rate and respiration. Here rate and depth will be increased. Then CO2 will come outside from the body. Then maintaining of the metabolic normal pH. Understood? Here what will happen? pH increased, HCO3 is there. Through ventilation, hyperventilation, H will separate and CO2 will separate. Carbon dioxide will come out from the lungs. Then pH will be maintained. Next we will, what is nursing management to avoid metabolic acidosis? Here we can avoid the fat food and also low fat diet, high calorie diet, sodium bicarbonate also we will give to the patient. Then we will discuss about the metabolic alkalosis. Alkalosis means always pH will be increased and HCO3 also will increased. Alkaline nature. HCO3 is alkaline nature, it will be increased. Where we can see this kind of cases, gastric suction, gastric lavage, and vomiting, alkaline drugs we will give, then diuretics also. These are all will increases the alkalosis in our blood. Alkaline nature blood we will see in these cases, and Crohn's disease also we will see. Sometimes massive blood transfusion also, approximately within 24 hours 10 units of blood we will give means there is a forming of alkalosis. So they will ask some type in massive blood transfusion which kind of acid base imbalance we will see. So the answer is metabolic alkalosis. And also they will ask in vomiting, gastric suction, and gastric alkaline drugs, diuretics if will give means which kind of acid base imbalance we will see. That is metabolic alkalosis. And some of the pregnant women also, they will frequently going for vomiting. In vomiting what will happen? All our gastric pH, gastric content will come outside. Then our gastric content is having HCl. Means hydrochloric acid. Here all HCl acidic nature will come outside from our stomach. Then there is a forming of H ions will be decreased, pH will increase. Then forming of metabolic alkalosis. Some of our hyperemesis gravidarum also, vomiting. In vomiting, suction, lavage, suction, gastric suction, everywhere we will see metabolic acid alkalosis. Next we will see some of questions discussed. Before discussing that compensate, uncompensate respiratory acidosis or alkalosis, we have to keep in our mind these three components. PaO2 normal is 35 to 45. pH normal is 7.35 to 7.45. Bicarbonates normal 22 to 26. In our blood, in our body, these are all the normal components. Let us discuss some of the questions which are very important for our exams. So compensation means what? If compensation, 3 points I told you, compensation means pH normal and any one pH normal, and this is called, if bicarbonates, CO2, we have to think these three components while checking compensation. If carbonates increased or decreased, carbon dioxide increased or decreased also, there is a pH is normal. Then our pH is normal, na? Then we will call compensation. If what is uncompensation? Uncompensation means here pH abnormal and then any one among the H2CO3 or carbon dioxide, one abnormal will be there. Then we will call uncompensation. Then partially compensation. These three they will ask frequently in examinations. Partially compensation means pH near normal, means more than 7.5. It may be more than 7.48. And HCO3 also abnormal, carbon dioxide also abnormal. Three things are abnormal and pH also near normal. Then we will call partially compensation. One by one I will explain you. Partially compensation example, pH 7.48. Then PaCO2 50. Normal how much? 35 to 40. Increased. HCO3 also increased. Then that is 30. So here this one also abnormal. This one also abnormal. This one also abnormal. This is called only slightly elevation of the carbon dioxide, partial oxygen, carbon dioxide levels. But bicarbonates increased more than 26. Then it is called partially compensated metabolic alkalosis. Means increased na. pH also increased and this one also increased. Then it is called metabolic alkalosis. Next we will discuss compensation. Compensation means how we will, means pH normal, compensation we will discuss here. pH 7.4 and then here pH 7.4. Thank you for listening. Next topic is as ABG analysis, how we will do ABG analysis and some of the compensate, uncompensate and partially compensate ABG imbalance we will discuss. If you like this video, please like, share and subscribe. Thank you.